Hello, I'm Larry Watkins, Vice President Client Strategy at WPC Healthcare, which is based in Nashville, Tennessee. Thanks for joining us today. We're going to discuss the significant revenue opportunities that are buried in your transaction detail. You'll soon find out that I live and breathe this stuff. My career has been all about data, standards, and revenue cycle solutions. I think we're at an unprecedented and interesting time in the United States healthcare industry in that we're finally given what we at WPC Healthcare call the retrospective predictive intelligence that's required to make significant improvements. In the face of value-based care and increasing financial pressures, utilizing these new tools to extend the skill sets of your team is paramount. A recent study was published by the American College of Healthcare Executives with more than 2,000 hospital executive responses. In this study, CEOs made it very clear that financial issues were the number one concern they face by a factor of 2 to 1. So if CEOs are worried, that puts CFOs and directors of revenue cycle on the hot seat. They need to identify creative methods to find some quarters in the proverbial couch. Based on our experience, every bit of that pressure is tied up in collecting payments from government and commercial insurance plans for what is owed. Sounds simple? It's not, and it's getting worse. Respondents to the survey indicated 3 primary financial concerns. Not surprisingly, these are collecting from government and other plans, converting charges to cash, and reducing bad debt. Breaking this down, understanding your insurance reimbursements becomes foundational. This knowledge provides the insights needed to collect more and write off less. It also leads to more effective collection of patient responsibility. It's simple. Collecting from payers is still too difficult and too mysterious, and the odds are stacked in favor of the payers. In light of the current reimbursement environment, what are the questions that are being asked around the C-suite? What are the questions that are often heard but not answered? Knowing the right questions is critical to getting answers that are actionable. Our experience in working with healthcare organizations on a national basis suggests that questions follow a pattern like these. How much money are we leaving on the table? How do I get that money? What kinds of issues are tying up that money? Which payers are causing the biggest delays? What types of services or patients have the most payment issues? And how do payers compare when they pay for similar services? WPC Healthcare has had a chance to work with an award-winning regional health system that has made impressive progress in optimizing reimbursements. They consistently perform well above the industry average in common key performance measures such as days in AR, case mix index, and discharge not final billed. Based on these measures, you might think that this organization doesn't really need any fine-tuning. In fact, you could argue that there's nothing else they could do. Well, this is exactly what we thought before we got their data and started to dig around a bit. What we discovered was significant and relevant to targeting reimbursement improvement opportunities. Using the WPC Healthcare Taproot solution to analyze and visualize their data, we were able to identify ongoing issues and problem areas. So what did we find and how? Let me show you some examples. Using the Taproot solution to perform an across-the-board data analysis of payments, adjustments, and denials from all payers, we determined a reimbursement performance score of nearly 90% for our hospital client. In essence, this score indicated that the health system was struggling to obtain about 10% of the dollars reasonably expected from payers. While most hospitals we work with actually perform much lower than this, 10% of insurance reimbursements is still a significant amount of money for a 250-bed hospital system. Note that this score does not include patient responsibility. Those payments are analyzed separately. You can see here that the system has actually been steadily improving in this performance over the past year. To get at the root of what was causing issues, we went straight to the data. Getting paid the appropriate amount without delay feels like an ongoing process of jumping through hoops and solving a complex mystery. However, by breaking down the payment and adjustment data, we were able to quickly understand our clients' top issues. First, we categorized the adjustment reasons to more easily determine where there are patterns. Patterns related to claim quality, eligibility, authorizations, medical necessity, policies, etc. Since we saw that this system had issues with eligibility denials, this visualization, as you can see in the top left, is filtered by the eligibility category. This helped us to see which payers are most impacted and what types of issues are being reported. As you can see, Blue Cross Blue Shield was the most highly impacted payer for eligibility-related denials. Hovering our cursor over the Blue Cross Blue Shield bubble, we get an insight cube that tells us that for the time period selected, nearly $3 million was put at risk due to issues related to Blue Cross Blue Shield eligibility. Seeing that Blue Cross Blue Shield is a payer we're interested in, we can then use the payer drop-down filter to narrow the results and see what the eligibility-related issues are for Blue Cross Blue Shield. As you can see in the lower half of the visualization, what we discovered from this analysis is that the issue was not as much related to ineligible patients as it was submitting claims for patients either after their coverage terminated or prior to their coverage beginning. Using the solution to drill down on these results, we were then able to look at specific patients to further understand the issue so that a solution could be put in place in the patient access department. This is just one example of how we, using the payment adjustment and denial data, were able to help our client unravel what was really happening and drive to pragmatic solutions to resolve the most problematic issues. We were also interested in seeing patterns of specific denials or adjustments related to specific types of patients or specific types of services. This visualization is an example where we use DRGs to get at this information, but service codes or revenue codes could be used as well. Here we determined that there were Medicare medical necessity issues related to the diseases of the musculoskeletal system. Drilling down on these results, we were able to look at specific records and identify the medical necessity issue. Solving this not only solved the payment issue, but also reduced the risk of problems during a future Medicare audit. In addition to reduced or denied payments, we were also interested in the speed at which claims were getting paid. This visualization enabled us to understand where time to payment was an issue for the hospital system. In particular, the information related to the specific contract types was interesting, so we could see where delays were occurring. You can see, for example, that the Aetna indemnity plans took much longer on average to pay claims than the Aetna PPO plans. Not only did this help us know where to look to investigate the issue, but we also expect that it will be good information to bring to the contract negotiation table. We also wanted to see if the type of patient or the type of service had an impact on time to payment. Here we found that DRGs related to gastroenterology were particularly problematic for United Healthcare claims. Another issue that our client struggled with, as most hospitals do, was the inability to compare payers side by side to understand which plans were most in need of a focused optimization effort. This visualization is one example of the types of comparisons the client was able to make, comparing based on average payment amounts, speed to payment, and number of adjustments and denials. Further filtering on specific service and patient types, as well as comparing results for similar contract types, was very helpful in determining where focus was needed. And so, in our analysis for our top-tier regional health system client, we identified ongoing issues related to poor claim quality, specific coding and HIM issues, eligibility issues for specific payers, delays in payments, authorization issues related to specific service types, and inefficiencies in managing denials. We were also able to automate administrative processes by making payer data more accessible, resulting in a more cost-effective use of resources, particularly in the patient accounting department. So can we really move the needle with this information? What we found is the opportunity is hidden in the details, and once those details were illuminated for our client, taking action became not only possible, but it became valuable. With these types of results, our hospital system client is able to identify and resolve issues throughout the hospital that cause reimbursement challenges. They're able to prioritize efforts that actually drive dollars. They're able to gain insight into payer trends and practices that directly impact reimbursements from those payers. They're able to understand and resolve issues more quickly and create payer accountability and improve payer contracts. We expect results from the improvements made as a result of the project to top $3 to $5 million in the first year for this 250-bed hospital system. And remember, this is for a top-tier provider that was already doing well by all current measures. As a result of all of this analysis, we were able to identify steps to improve this hospital's cash position both now and moving forward. The specific steps that we identified to capitalize on the opportunities found buried in the transaction detail are to identify and prioritize process improvements that drive dollars, to determine the effectiveness of departments across the hospital to generate the right claims the right way to generate the right payment, to remove the mystery of payment results and create accountability for payers, to ease and speed up the process of denials and appeals through payment insight, to collect accurate and meaningful data to use in payer negotiations, and many other items. Now we realize that most organizations are not operating at the top of the bell curve like our client. Our objective in this exercise was to highlight that even at the top end, there is additional value to be captured, and there really is something that can be done to turn the analysis into results. Given the difficult road ahead for many hospital organizations, it's critical to gain control of your revenue cycle now, so you're prepared to take action when opportunity arises. Thanks for taking the time to be part of this discussion. I'll now take your questions.